On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. Statistics show that 30% of people over age 65 fall each year. What may seem as a simple accident can have very serious consequences. Falls are the #1 cause of both fatal and non-fatal injuries to older persons. On today's show, we will take a look at how falls affect older adults, and we will discuss changes that you can make to reduce your risk of falling. I'm pleased to welcome Pat Savonic, who is the Health and Wellness Coordinator with CARES, and Joe Mastriandria, the Trauma Program Director for the Regional Medical Center at Bayonet Point. Thank you for joining us today. It's good to have Pat to have you back, and Joe for you to be joining us. And this is such an important topic. Until we encounter a fall, we don't know the consequences. We don't think about the impact it can have. But Pat, how frequently are falls happening among older people?
Well, you mentioned 30%. I think if you say one person out of every three, means one of us is going to fall, and it becomes a life-changing event sometimes for an older adult.
Exactly. Joe, we were talking before the show. It sounds like Regional Medical Center at Bayonet Point has taken a particular interest in falls, and you have done some gathering of statistics locally of what is happening and the impact. Can you share that with us?
Sure. Our #1 mechanism of injury or diagnosis is for falls. When we looked at the fall data, we were able to look at what's called ground level falls, or falling from a standing position. Out of those people that fell from a standing position, 84% of them were over the age of 60.
Okay.
And then unfortunately, when they come to the hospital, they are either admitted to an orthopedic floor because of their injury, or to the ICU depending on what kind of health history they have, whether they have heart problems or breathing problems or diabetes.
What type of injuries are you seeing when they come in after the fall?
The #1 would be hip fractures. Okay, and then followed by, more so in women, they tend to break their upper arm or their humerus. All of these require admission because they need evaluation by rehab. Unfortunately, when they come to the hospital, when they're ready for discharge, about 60% of the people go to either a nursing home or to a rehab facility. There's only 30% of the people that actually make it back to their house.
So this links with Pat saying this is a life-changing event.
Correct.
And you know, as we grow up, we fall. You know, from the time you take your first steps, we're used to our children falling, we're used to middle-age falls. But when you're talking about serious, serious consequences, and you know, I have thought seniors are more risk of falls, and your evidence is bearing that out. But it sounds like the consequences are much more serious, and the recovery is much more serious.
Correct. A younger person that falls will bounce back a little bit quicker. They're more likely to go home, which is great. Unfortunately, as we age, we have all these other medical histories that also affect our healing process and the time to recover. And that will affect how fast you'll make it home, and more importantly, your recovery afterwards.
You had mentioned those who come into the emergency room, and many go to the orthopedic floor, and then people go to ICU. Are you seeing head injuries that result from these falls?
Yes. Unfortunately, again, based on medical history of the patients, a lot of people are on blood thinners, whether it's aspirin, Plavix, Coumadin. And when they fall, they tend not to put their arms out. So when they fall, they hit their head and they get a traumatic bleed. Those have to be watched. Sometimes you'll have cognitive changes related to those bleeds. And again, it just prolongs any kind of healing process. And more importantly, keeps you from going home. And that's the most important thing that you need to understand, that unfortunately, the people that fall, again, your chances of making it back to your house by yourself without home health care is about 25%. So.
And it sounds like there is a team approach. Every effort is made to get the person back to restore their life as it was, whether it is through home health care in the home or going to a rehab facility where physical therapy, occupational therapy is offered. Talk with me some about that, what some of those options are.
Correct. What we do is whenever we have a patient that is injured, they immediately get a consult from rehab. Rehab consists of occupational therapy and physical therapy, where when you have these injuries like a hip injury and you have a repair, you need to learn how to walk with a walker because you still can't bear weight. If you break your upper arm, you may have something as simple as buttoning a button is going to be difficult because you have to raise your hand. So occupational therapy helps work with both the patient and the family that are there, so that way when you do get to go home or further care in a rehab setting, you'll have the tools necessary to help you in.
You'll have some strategies too.
Correct.
Both
Correct.
And whether it's a walker or another assistive device, through the rehab process you learn to use it. So you can be as independent as possible is always
That's
the goal.
Yes.
Yes. Well, you've certainly caught our attention with, when we think that 1 out of 3 elders are going to fall every year, and then only one out of 3 is going to be able to return to their home after they have been to the emergency room. We're talking about serious life impacts. So let's talk some about, when should the red flags go up? If I am a person who is at risk of falling, what are some of those red flags? Certainly a person who already has a history of falling, but what are some of the contributing factors?
Well, there's always a reason. Falling is a symptom of something.
Okay.
It may be a symptom of the fact that you're not paying attention, but it can also be medications.
Okay.
Can cause
a
us
change in
to
medication?
be dizzy or lightheaded. It can be nutrition. Many of us who live alone don't want to bother to fix balanced meals, so nutrition can also contribute to low blood sugars, make you dizzy, and disoriented is the word I'm looking for. Clutter.
Environmental factors.
Environmental factors.
The rugs.
Yeah. Everybody talks about pick up your scatter rugs, and you should. If you're going to leave them down, make sure they're down so they cannot slip or they don't lift up when you trip over them. So pets, the dog or the cat who's running around under your feet in the kitchen. Most of the most of them occur either in the bathroom or the kitchen in your own home. They don't happen out on the street somewhere. Though parking bumpers is also a good contributor. There's just so many things in our environment that I think if I was going to boil it down into 2 words, it would be pay attention to what you're doing.
So much of the aging process, that's what I hear. Whether it is about driving, things that we took for granted that our bodies just did automatically. Now we need to work our minds also in terms of having strategies about how to do things, of just doing them more slowly.
And one other thing that I think about is as we get older, we have a tendency to shuffle, to not pick our feet up.
Okay.
And it's so easy to trip over anything, just a small raise in the concrete, when you're on the sidewalk, or a rough place in your carpet. When you're shuffling your feet, you're going to fall. So one of the things that we like to emphasize in some of the classes that we do is to learn to pick up your feet, to lift them enough so that you're not putting yourself at risk.
Okay, all good advice. All good advice. From a medical perspective, Joe, are there some factors that enter into the risk of falling that we haven't mentioned?
Again, what Pat said, change in medication is very important. And more importantly, your medical history. Unfortunately, again, as we get older, sometimes we do become frail, and the worst thing that you can do is just stop doing. You need to get out and move a little bit. You need to also, like you said there, work on the cognitive, the crossword puzzles and such. The important thing is to be aware, and that's the real problem where people in this day and age are rushed. You need to stop, take a breath, look around, make sure you're feeling comfortable with what's going on around you, and then focus on the rest of it, which again, stay active. You don't have to run a marathon. You just need to get up and walk across the room, and that's the important thing. And then again, with your family and friends, pay attention to what's going on with your family members. It's important. I was able to work with Pat, and I noticed that there was a problem where family didn't recognize that mom, dad, or grandma or grandpa needed help with just changing a light bulb. And they don't want to ask because we are very independent. So offer it. If you know dad won't take any help, then ask mom. Mom, what's going on? Are all the lights working? Little things like that, and you got to use it to your strategy to be able to assist them because they were there for you all along. You need to be there for them. But
again, it's a conscious process of when you go to visit your older family members. Of we typically sit down and the cookies come out, and but my husband has gotten the habit of doing whatever needs to be done around the house as he's talking to his mother, changing the light bulb, and one of the things he put in grab rails, and it has really increased her independence. At first there was a resistance and they make more attractive ones now than they used to, but there was a resistance in putting in something medical in the home. But it really has, again, allowed her to be more secure and more independent by making some of those changes. So it's, again, a matter of viewers who are younger and have family members of thinking, what can you do?
Correct. And you can politely remind them that, again, you don't want to scare them, but, I don't want you to fall because I want you to be home so I can come and visit you at home. Because, again, our numbers that we look at are based on also the same numbers of Department of Health of Florida and also national average. They're all about the same.
So Pasco County is not different than elsewhere in the state of Florida. And you had mentioned before the show that approximately 6% of those who are admitted for a fall, they die. It becomes a fatal injury.
Yes, and that number of 60 or older, 6% of the people that are admitted to our facility die as a direct result of their injuries. So, again, we love our family, we love our loved ones, and we want to make sure that we're there for them. And we don't want to scare them, but we also want to more importantly, make them aware and inform them that whatever we need to do to keep you at home where you've been, we'll do.
And we need to be proactive beforehand. I assume this is something to discuss with your doctor, just as you discuss other medical conditions, that if you feel that you are less stable on your feet, that's a good starting place to start that conversation?
Correct. And the physicians do have access to be able to recommend home assistance. They can put in referrals for rehab. And again, talking to your physician is really important, but talk to your family and friends also. And that way at least you can start the process because, again, it's being aware of what's going on.
Pat, in the second segment, we're going to talk about the Matter of Balance class. So you have a lot of experience teaching strategies about preventing falls. But something that comes up is the fear of falling. That in itself creates some limitations.
It does.
Tell us.
It becomes a vicious cycle because if you're afraid you're going to fall, then you're afraid to do anything. If you don't do anything, then you're more at risk for falling.
And how do we break that cycle?
To break that cycle, you have to, as he said, exercise some, move. Maybe it's get up during the commercials and walk through the house, not necessarily to the refrigerator, but to walk through the house and get the circulation going. If you go to the Walmart, walk around the outside edges, that's a long walk. And use your walker. Use your cane. Whatever the doctor has prescribed or the physical therapist has prescribed for you, use those assistive devices. That's what they're there for, and they can really reduce your risk of falling. So the important thing is to stay active, pay attention, use your assistive devices as you need to, and don't just sit and become a couch potato. You retire and think, I don't have to do this anymore. Well, yeah, you do. You want to have the best quality of life you can have.
And most people want to be as independent for as long as possible. They may not want to live to 100, but whatever we are given in terms of years of life, we want them to be the most
Well,
rewarding.
if I'm going to live to 100, I want to at least be able to take care of myself. You know,
Yes.
and I think that's the important
And
thing.
this is part of the plan. You've shared such good information with us, and certainly, Joe, your statistics have caught our attention in terms of how essential this is as we plan for good quality life. During the second segment, Pat, we want to talk some more about the classes that are offered in the community that really are addressing balance and helping people to prevent falls. So I hope our audience will join us for the second segment as we learn about those classes.
Elder abuse is always devastating, but it may not always be obvious. Isolation, coercion, and the withholding of medication are only a few of the more subtle forms of elder abuse that occur every day to thousands of our senior citizens. Please join me in the fight to end elder abuse. Our elders deserve better. Visit the website of the National Center on Elder Abuse. It's time to speak up.
Today we are talking about the serious consequences of falls and some community classes that can help you reduce your risk of falling. Joining us for this segment are Pat Savonic, the Health and Wellness Coordinator with CARES, and Pat Reynolds, a participant in the classes. Pat, in the first segment we discussed the serious consequences of falls and some of the preventative measures that people could take at home.
Right.
But there are actually classes that CARES is offering in the community that will help people both become stronger and develop strategies. Tell us about those classes.
Well, one of them is the Matter of Balance, and it is an evidence-based program that's been developed by Boston University. It meets for 8 sessions, sometimes depending on the host organization, whether we meet twice a week for 4 weeks or once a week for 8 weeks. It can be either way. They meet for about 2 hours each time, and it's all about reducing your risk of falling and your fear of falling.
Okay.
Because oftentimes, as I said before, the fear of falling just contributes to your risk more and more. So it's a great program. It talks a lot about how you can change your mindset about falling, as well as giving you some exercises to help you to keep your body more attuned, your muscles still working. You know, like I said a minute ago, if you don't use it, you lose it.
Right,
So,
staying active.
Yeah, staying active.
And Pat, you have participated, we're going to be discussing 2 classes right now. We're discussing Matter of Balance, but you've been a participant in both classes.
Yes, I have.
How did you become aware of the Matter of Balance class, and why did you participate? What was?
Well, I actually became aware through a woman in our park that had taken the balance class. And she was so enthusiastic about it because how it had helped her keep her going on a daily basis without losing mobility. And so I thought, well, I had sprained my ankle twice, and I thought, well, you know, that's a weak part on me, so perhaps the balance class will help me. And the class is so informative. It starts out very casual. The instructors are excellent people. They take their time. They're very educational with the material. And you start out admitting that perhaps you have some fears or some challenges in life. And how are you going to address them, or how have the other people on the panel, there were about 15 of us, how we've, you know, taken those challenges and what we've done to try to prevent them or what we could do to prevent them. So
you're learning from other people's life experience.
Yes.
It's not, you're bringing the Boston University program, a structured program, but I'm hearing you say that wisdom is there that is shared.
It certainly is, because you're never too old to learn something every day. And living in a 55 and over park, I can see some of our friends, how they've decreased in activity and what has happened to them because of falls and injuries. And I don't want to be one of those people. I don't want to be one of 3.
Right.
I would like to be as active and physically fit as long as possible. And when you take this class, when you admit that perhaps there are problems, that's one step in correcting the problem.
Okay.
And then addressing the problem, and then getting ideas from the instructor and also from the other participants on how to handle the problem. Perhaps you just haven't addressed it correctly. You're not being aware of your environment, how you're doing something, or the lack of your mobility, and how can I correct that? And their exercises they teach you are very, very simple. And as you start doing them, you start becoming aware of how much stronger your legs are and your arms are. And maybe it's easier to get out of a chair or perhaps go up a step, or to even watch when you're walking that you can't look down what you're going to trip over, you look ahead and you look for, you know, obstacles per se so that that doesn't happen. And your posture on, you know, actually standing so that you're not slumped over, and perhaps you could fall, you know, just from that. And shuffling your feet is a major problem with elderly people. They have knee problems, they have ankle problems, they have hip problems. It's just easier to scurry around than to lift them. And when you're just sitting and you're lifting your legs up and down, it seems like that's not going to do anything for me, but it actually strengthens and starts toning your legs so that when you do start walking, that leg might come up higher.
Now, Pat, are these, were you going once a week or twice a week?
We had our class twice a week for a month.
And then would you take these exercises home and do them?
Yes, we had a pamphlet that explained everything with all the instructions on it. So if mentally you were being challenged, you could visualize it and see it on the paper. And you could see, well, okay, now we're just going to do a simple exercise, and we're going to turn our head so that when we drive, we can see if a car's coming or if there, you know, is some obstacle in our peripheral vision. So many people can't turn their head sideways. It becomes so arthritic that you have, you know, just a certain amount that you can move. But if you, yes. And so you're driving, and maybe you're not looking at the mirror, and you're not turning, so your accident's more prone. Wind up in the hospital, as Joe said, and having injuries that is going to even make you more handicapped.
From the point that you started taking the class until the end of the class, what did you accomplish by the end of the class?
I think it's the empowerment that you can really change your life, and that it's the drive to do it, because it's so easy to say, my knee hurts, I'm not going to lift my leg up and down and, you know, try to strengthen it. It hurts too much. If you start off very slowly and just do a few exercises per day or several times a day, you can increase that mobility and you can increase that strength, and that makes you feel good. And when you feel good, I think you have a tendency to do more things. You become more involved. So beside your brain functioning, the rest of the body is going along with it, and you're not just sitting in a chair and aging and being frightened and saying, I can't do it.
Very good points. Pat, the classes are offered throughout Pasco and Pinellas County?
Right.
And there is no charge for the class?
There is no charge for the class. And we do them in the senior centers, in the senior housing facilities, mobile home parks, just any place someone will have us. As long as we have 10 people, 8 or 10 people who are willing to meet together. As Pat said, it's very interactive, obviously. Everybody gets to participate.
During this segment of the show, we will run the telephone number for CARE, so interested viewers can contact you to learn about where the classes are offered in the 2 counties and more about the classes. Aging Well Center in Clearwater also offers a Matter of Balance class, so we will run their telephone number for classes that are in Clearwater. Pat obviously is a very physically fit and independent person. Persons who already have some physical limitations, would they be appropriate to take this class?
Absolutely. You can do this in a wheelchair. You can do it, you know, anywhere. You don't have to be physically able at all. It's funny, I had a lady tell me the other day that she had been isolating but someone told her to come down to the class. She lived upstairs in the senior housing. And she told us the other day that she was out with people now, and it had changed her life.
Wow.
I thought that
what
was
a
awesome.
statement. What a statement. We only have several minutes left, but I want to mention the Tai Chi class, too, which ties into this. You don't you can take the classes independently, I understand, but that's another class that CARES offers in both counties.
The Tai Chi is called Tai Chi Moving for Better Balance, and it's also an evidence-based program that comes out of the Oregon Research Institute. And they have designed this program specifically to increase the balance and mobility for older adults. So it's really just 8 forms of Tai Chi, and there's, designed to improve your balance. They meet for 24 sessions, and it's always twice a week for 12 weeks.
And in this class, you're actually spending more time moving than talking.
Actually doing the Tai Chi forms. It meets for 1 hour. And that's plenty by the time you've done Tai Chi for an hour.
And again, is a person of any mobility able to take that class?
Anyone can come. We have people in wheelchairs. We have people on walkers. If you can't do it standing, you can do it sitting in your chair.
Right.
You can do it.
What an opening.
Yeah, it's really amazing.
It's remarkable. We were fortunate to have both programs come into our park. So if you didn't drive and you weren't mobile, you could still get to it. We had people in wheelchairs. We had people in walkers with canes. And you can improvise. You can even have that chair in front of you when you're taking the movements. I feel personally that when you take the balance class, you have opened to be receptive to helping yourself, number one. Number two is you have strengthened your body in some manner, so that it's like a continuation because you're doing additional moves and they become so much easier as you do them. We've had a woman that just had a knee replacement and she was having great difficulty. She's saying now that she's moving her leg much, much better than she ever did before because of the Tai Chi.
I am so pleased that we're able to share the information about these programs, and Pat, that you can speak personally about your experience, especially after we've heard how serious this problem is, so that our viewers, whether you are a senior yourself or a friend of a senior, you can talk about how important falls are, and then start to implement some of the strategies, take advantage of some of the community resources. Thank you, Pat and Pat, for joining us today. I wish you the best of success as you continue these programs, and I thank our audience for joining us to hear about this important topic.
Elder abuse is always devastating, but it may not always be obvious. Isolation, coercion, and the withholding of medication are only a few of the more subtle forms of elder abuse that occur every day to thousands of our senior citizens. Please join me in the fight to end elder abuse. Our elders deserve better. Visit the website of the National Center on Elder Abuse. It's time to speak up.